This is a type of virus called a coronavirus. We've had viruses similar to this that have circulated around for a number of years, and many people would have gotten infected with them. They cause like a common cold-like illness, and they're not at all serious. But this particular virus, while it belongs to that family of viruses, has managed to adapt and move into human populations, and it probably only did that around about November of last year.
Coronaviruses, I think there are 7 have been identified, and a number of them, SARS and MERS excluded, constantly circulate in society, in the community, and they cause a common cold. So they'll infect your upper respiratory tract and give you common cold symptoms. So we've known about coronaviruses for a long time. We've known of them as a respiratory infection and their potential to cause disease. It's only been in much more recent years with SARS and MERS and now this novel SARS-like coronavirus that we understand that these coronaviruses can cause very serious diseases as well.
I've been working in this field for about 20 years, and this is the most extraordinary pandemic I've ever seen or been involved with. There obviously have been other pandemics that in our lifetimes, like in 2009, the swine flu one, and 2003, the SARS coronavirus, among others. But this one is different because really nobody is immune to it. No one in the world has even partial immunity to it, except for those people who've now had it and recovered. And it's very infectious.
Unfortunately, it's a virus that is reasonably effective at being able to be transmitted from one person to another. And while it causes mild infection in many people, and in many people, in fact, they aren't even aware that they have infection, in a smaller number of people, perhaps 10 to 15%, it can cause a far more severe response that can lead to hospitalisation, and then in about 5%, that can mean very serious breathing problems that need to be treated in intensive care. If you are unfortunate enough to be in that small group, then the risks of very serious consequences and even death are quite high.
For most people, they might have a mild illness or possibly no illness at all. If people are a bit more sick than that and need to come to hospital, they'll get assessed. If they're not sick enough to need hospitalisation, our plan is to manage that person in their home at the moment, because we don't have the capacity to admit everyone to hospital unless they really need it. They will be monitored at home on a daily basis by the public health unit, and we're setting up a hospital in the home unit to do that as well. If any of those people become ill enough to need hospitalisation, or they're sick enough in the first place, they'll be admitted to hospital and treated with supportive care.
It is true that people who are older are at greater risk, and that risk really does start to go up from 60 onwards. It is true that people who have chronic medical conditions, such as chronic heart disease, diabetes, lung disease, and also cancers, are at greater risk as well. So anybody can get this infection and get serious consequences of it, but more importantly, they can pass it on to somebody else whose risk is even greater, and that person could end up in hospital or could end up dying. And the chances are, of course, that that person will be somebody that you know.